All right, so cryoneurolysis. It's like, whoa, right.
Yeah, it's pretty incredible what they're doing with this.
We've been going through all this research, and some of it, like, seriously impressive results.
It's really cool how it's being used for, like, spasticity and pain management.
Exactly. Things that people, like, struggle with every single day.
Right, and think about it. For conditions like spasticity, where your muscles are constantly tight.
It's like they just won't chill out.
Exactly, they just don't want to relax. And traditional treatments, they often involve, like, repeated injections.
Oh, yeah. I've heard about that, like Botox, right?
Yeah, Botox is common, or even, in some cases, surgery.
Which, whoa, invasive much.
But cryoneurolysis, this could be, like, a game changer.
Okay, so break it down for us. What makes it so special?
Well, imagine a one-time procedure.
One and done.
Potentially, yeah. And the relief it could bring, we're talking weeks, months, even years.
Seriously. Years. That's incredible.
That's the potential we're talking about here. It's like, hitting a reset button on those overactive nerves.
Okay, so how does it even work? Resetting nerves sounds kind of intense.
It is pretty high-tech. They basically target those troublesome nerves with crazy cold temperatures.
Like, how cold are we talking?
Like colder than Meganer 60 degrees?
Yeah. Brr. That's colder than my freezer.
Yeah, it's seriously cold. This deep freeze disrupts the nerve's ability to, like, send those pain or spasm signals.
Okay, wait. Freezing a nerve doesn't sound very, reversible.
And that's the cool part. It's not about destroying the nerve. It's about disrupting those signals.
Okay, but freezing. I need more details. How do they disrupt without destroying?
It causes something called axonotemesis.
Axono what now?
Yeah, it's a mouthful. But basically, think of it like this. It puts the nerve's signal transmission on pause.
Like a timeout for those rowdy nerves.
Exactly. A long timeout. Gives you a break from the pain and stiffness.
So how long is this timeout?
The nerve can regenerate, so it's not a permanent thing, but that's what's so unique about it. It's a long-lasting solution, but still reversible.
Reversible, but durable. I like the sound of that.
Yeah, that's what's got doctors and researchers so excited.
So you're telling me we can hit pause on these overactive nerves for a good long while?
That's the idea.
Okay, I'm sold on the why. Now let's talk who. You mentioned some impressive results. Tell me about the people this has helped.
Absolutely. Let's start with a 64-year-old woman. She'd been dealing with post-stroke spasticity in her shoulder for, get this, 16 years.
16 years. Oh my gosh, that's longer than some people have been driving.
Yeah, it was tough. Imagine the limited movement, the pain, struggling with everyday stuff.
Things most of us take for granted.
Exactly. And this wasn't just your typical spasticity case. She also had what's called a contracture in her chest.
A contracture, like her muscles were stuck.
Kind of. Basically, it was this tight muscle in her chest constantly pulling her shoulder inward. It made things even more complicated.
Double whammy. So how do they even begin to treat something like that?
They did something really interesting. They used a nerve block diagnostically to figure out the best way to address both the spasticity and the contracted muscle.
Okay, so a nerve block, like a test run to see what's what.
Exactly. Helps them pinpoint the exact nerves causing the problem.
So precise. It's like they're, mapping out the nervous system.
Pretty much. And based on that, they decided to combine cryoneurolysis on the nerves around her shoulder with a procedure to release that tight chest tendon. They did it all at once.
Talk about efficiency. But wait, 2 procedures at once. That sounds intense. What about anesthesia?
That's the amazing part. They did it all without general anesthesia.
Whoa, really?
Yep. So quicker recovery time, fewer risks, the whole 9 yards.
Sign me up.
Eh?
Okay, so results time. What happened?
She had immediate improvement in her range of motion right there on the table.
No way. That's incredible.
And get this. 8 weeks later, she could shave her underarm comfortably for the first time in years.
Oh, wow. It's those little things, right? Things we don't even think about.
Exactly. It's not just about restoring movement. It's about restoring those simple joys.
Totally. Okay, another case. Hit me.
Okay, this one's really interesting. We've got a 52-year-old man with C4 quadriplegia.
C4 quadriplegia, meaning?
Paralysis affecting both his arms and legs. He used a wheelchair.
So already dealing with a lot.
Yeah. And he had really severe muscle stiffness, especially this tough hip flexion deformity, made basic movements so difficult.
Like, what kind of movements are we talking about here?
Think about, like, getting dressed, getting in and out of bed, just basic mobility. It was a constant struggle.
Okay, so serious spasticity. Did they try the usual suspects, like Botox?
They did. But because his condition was so complex, Botox just wasn't cutting it.
Didn't have enough power.
Kind of. And to make matters worse, his hip deformity made it hard to even access some of the muscles for treatment.
So it's like a catch-22. The very thing they need to treat is also preventing treatment.
Exactly. It was a tough situation, but that's where cryoneurolysis really shines, because it can be so versatile.
Okay, I'm intrigued. How did they use it in this case?
They used it to target multiple nerves in both his arms and legs. And here's where it gets cool. They even went for the sartorius muscle to help with the hip flexion.
The sartorius, that's not usually mentioned with cryoneurolysis for hips, is it?
Not typically, no. But in his case, it was key.
Like a hidden pathway.
Exactly. And that's what's so amazing about this. It highlights how cryoneurolysis can be tailored to each person. It's not one size fits all.
I like that. It's like personalized medicine, but for spasticity.
That's a great way to put it.
So what happened with this gentleman? What did this personalized approach do for him?
After the procedure, he could shower and move around with more ease than he had in years.
Wow, showering. That's like such a fundamental part of feeling human.
It is, and to have that independence back, it's huge.
Absolutely. And the effects, how long did they last?
9 months.
9 months. That's incredible. Okay, so far we focused on cryoneurolysis for muscle spasticity. Some really impressive results. But it's not just about relaxing muscles, right?
You got it. There's a whole other side to this, cryoneurolysis for pain management. And we're not just talking about your typical osteoarthritis either.
Oh. Okay, now you've got my attention. Pain management is a big deal. Fill me in.
We're talking about the potential to shut down, interrupt chronic pain signals for all sorts of conditions, providing weeks, even months of relief.
Instead of just masking the pain, it's like they're addressing the root cause.
That's the goal.
I like it. Okay, I need an example. Who has this helped in the pain department?
Let me tell you about this 50-year-old woman, multiple sclerosis. She'd been dealing with debilitating foot pain and something called toe clawing.
Oh, I've heard of that. It's like your toes are constantly curled under.
Yeah, exactly, making it impossible to walk comfortably.
Ouch. I can't even imagine.
She couldn't even lift her toes, and this had been going on for 20 years.
20 years. And traditional treatments weren't doing the trick.
They offered very little relief. It was a constant battle.
Oh, man. So how does cryoneurolysis even come into play with something like that?
Well, her case was tricky because it involved both sensory and motor nerves. So she wasn't just dealing with pain signals going haywire.
Her toes weren't working properly either.
Right, like a double whammy of discomfort and limited mobility.
So how do you even begin to tackle both those issues?
That's where the precision of cryoneurolysis comes in. They targeted 2 specific nerves in her foot, the tibial nerve, which controls some of the toe muscles, and the superficial fibular nerve, which handles sensation on the top of the foot.
2 birds, one very precise, very cold stone.
Exactly.
So what happened? Did it work?
She felt immediate pain relief after the procedure.
Get out. Seriously.
Seriously. And for the first time in 2 decades, she could wiggle her toes.
I'm getting chills. That is incredible.
It is amazing, isn't it?
It's like not just physical relief, but emotional release as well.
Yeah, it's powerful stuff.
Okay, we've covered a lot of ground here with spasticity and pain, but I'm curious, how does cryoneurolysis stack up against other options out there? Because it's not the only game in town, right?
You're right. It's not a magic bullet, and it's definitely not the only tool. The best approach depends on the person, their condition, the whole picture.
So it's like a toolbox, and cryoneurolysis is one of the tools.
Exactly. It's about finding the right tool for the job.
Makes sense. So let's talk about those other tools. For spasticity, we've got Botox, which you mentioned earlier.
Yeah, Botox. It's often the first line of treatment for spasticity.
Because it's less scary than surgery?
It's minimally invasive, generally very safe. The downside is it's temporary.
Like how temporary are we talking?
A few months, usually. So you need repeat injections, which can be a pain, literally.
Literally a pain.
Mm-hmm.
Okay, so where does cryoneurolysis fit in?
That's where it gets interesting. Cryoneurolysis offers longer-lasting effects. Remember those cases we discussed? We're talking weeks, months, even years of potential relief from a single treatment.
Versus a few months with Botox.
Exactly. Fewer procedures, less disruption to your life, and potentially lower costs in the long run.
That's a pretty compelling argument. But does it work as well as Botox?
It really depends. The muscles involved, the severity of the spasticity, how the individual responds, there are a lot of factors.
So it's a conversation, not a guarantee.
Exactly. A conversation between the patient and their doctor to weigh the pros and cons.
Makes sense. So what about surgery? Where does that fit into all of this?
Surgery is usually reserved for severe cases, the ones that don't respond well to things like Botox or cryoneurolysis.
So like the big guns.
Yeah, exactly. More invasive, obviously, more risks, longer recovery. But for some, it might be the best or only option for real, lasting improvement.
Okay, so if I'm hearing you correctly, cryoneurolysis is like the middle ground between Botox and surgery.
That's a great way to put it. Less invasive than surgery, longer lasting than Botox. It's a solid option for a lot of people.
That's really helpful to know. Now, you mentioned that cryoneurolysis could be a good alternative to pain meds, too, especially opioids, which, let's be honest, those come with a whole other set of challenges.
Absolutely. And the potential for dependence is a serious concern. Cryoneurolysis offers a different approach. Rather than masking the pain, it's about disrupting those pain signals altogether.
Getting to the root of the problem.
Exactly. And because the effects can last for so long, it could potentially reduce or eliminate the need for pain meds entirely.
Which, let's be real, would be a game changer for so many people.
I think so too.
Okay, so we've got this promising treatment option, but there's still some unknowns. What does the future hold for cryoneurolysis?
Well, it's a rapidly evolving field, that's for sure. New applications are popping up all the time.
Like what? Give me the good stuff.
One area that's really exciting is using cryoneurolysis as a preventative measure for pain, particularly after surgery.
Wait, hold up. Preventative. You can stop post-op pain before it even starts.
That's the idea. It's called preemptive analgesia.
Fancy word alert.
Basically, before surgery, they use ultrasound to pinpoint the nerves that transmit pain signals in the area where they'll be operating.
Okay, and that.
They apply cryoneurolysis to those nerves, creating this numbing effect that lasts even after the surgery and anesthesia wear off.
So you wake up and boom, less pain.
Exactly. Less pain, fewer pain meds, faster recovery. It could be huge, especially for people at risk for complications from opioids or those facing complex surgeries with long, painful recoveries.
That is incredible.
Yeah, it's pretty remarkable stuff.
So as we wrap up, what's the key takeaway here? What do you want our listeners to remember about cryoneurolysis?
I think the biggest takeaway is this is just the beginning. Cryoneurolysis has so much potential, and we're only just scratching the surface.
And that's pretty exciting.
It is. New discoveries are being made all the time.
It's like a whole new frontier in pain and spasticity management.
I like that. A new frontier. It really is.
So for those of us who aren't doctors or scientists, what can we do? How can we stay informed about all this?
Stay curious. Ask questions. Talk to your healthcare providers about new treatment options.
Basically, don't be afraid to advocate for yourself and your health.
Exactly.
Right.
Knowledge is power, especially when it comes to your well-being.
Couldn't agree more. Well, on that note, we'll wrap up part 1 of our deep dive into cryoneurolysis. This next case, it's like something out of a movie. You know?
Oh, yeah. Tell me more.
Okay, so we've got this 50-year-old woman, right? She's been living with MS for years.
Multiple sclerosis. Tough diagnosis.
Right, really tough. And one of the things she was dealing with was this incredible foot pain, like debilitating.
Yeah.
Plus she had toe clawing, which, let me tell you.
Not fun. The toes curl under makes walking almost impossible.
Exactly. And get this, she hadn't been able to lift her toes for like 2 decades. 2 decades.
Wow, 20 years of that. That's got to wear you down.
Right. And it's not like the traditional treatments were helping much either.
Yeah. Chronic pain, especially nerve-related pain, it's notoriously difficult to treat. Traditional methods often just don't cut it.
And that's where this case takes a turn, right?
Right.
Because they decided to try cryoneurolysis. But even then, it wasn't straightforward.
What do you mean? What made this case so unique?
Well, it wasn't just about managing pain signals. Remember, she had both sensory and motor nerves involved.
Ah, I see. So it wasn't just about the pain itself, but also how those nerves were affecting her movement, the toe clawing.
Exactly. It's like if her nerves were a band, they were playing all the wrong notes, and the conductor was nowhere to be found. Chaos.
A recipe for discomfort and limited mobility, for sure. So how did they address that double whammy with cryoneurolysis?
They got strategic. They targeted 2 very specific nerves in her foot. The tibial nerve, which, from what I understand, is kind of a big deal when it comes to toe muscles.
It does play a role in controlling some of those muscles, yeah.
Right, and then they also went for the superficial fibular nerve, which is all about sensation on the top of the foot. So they're addressing both the pain and the movement issue all in one go.
2 birds, 1 stone. Or in this case, one very precise application of extreme cold.
And the results. I'm on the edge of my seat here.
Okay, are you ready for this? She felt pain relief immediately after the procedure.
No way. Immediately. Come on, that's got to be some kind of record.
And if that wasn't enough, for the first time in 2 decades, she could wiggle her toes.
Are you serious? After 20 years? That's beefless. That's incredible.
It's moments like that that remind me why we do what we do. The potential for this treatment to truly change lives is just remarkable.
It's those kinds of stories that really stick with you, the ones where you see someone reclaim a part of themselves they thought was gone forever. It's powerful stuff.
It really is. And it highlights a crucial aspect of cryoneurolysis that we haven't really touched on yet,
Sure.
the psychological impact. We often focus on the physical improvements, the reduced pain, the increased mobility, but we can't forget about the mental and emotional burden that these conditions often carry. Oh, absolutely. Imagine the frustration, the sense of being trapped in your own body, unable to do the things that others take for granted. It's got to be exhausting, not just physically, but mentally and emotionally as well.
Exactly. And that's where cryoneurolysis can be so transformative. By providing a break from these struggles, it's not just working on the nerves and muscles, it's working on the spirit too. It can be incredibly empowering for people to regain that sense of control over their bodies and their lives.
It's like they can finally breathe again, And it's not just the individual cases either. Remember when we were talking about the man with C4 quadriplegia, the one where they targeted his sartorius muscle?
The one with the hip flexion issues,
Yeah.
remember.
That case really highlighted the potential for personalized treatment with cryoneurolysis. It's not about some rigid, one-size-fits-all protocol. It's about adapting the approach to each person's unique needs.
It's like having a conversation with the nervous system, figuring out where the communication breakdowns are happening, and gently guiding it back on track.
It's like giving the nervous system a little pep talk, right? Encouraging it to work with you, not against you.
Exactly. And that potential for personalization is what has researchers so excited about the future of this treatment.
Speaking of the future, we've explored cryoneurolysis for spasticity, seen some incredible results, even touched on the psychological benefits. But let's shift gears a bit and dive deeper into this whole pain management side of things.
Right, because while we've mentioned how it can provide relief for chronic pain beyond osteoarthritis, we've only scratched the surface of the types of pain it can address.
Okay, so what other pain monsters can this cryoneurolysis thing tackle?
Well, one of the most common and often debilitating types of pain is neuropathic pain. And this isn't your typical muscle ache or joint pain. This pain originates from the nerves themselves.
From the nerves themselves. So it's like the nerves are sending out an SOS, but no one knows exactly what's wrong.
Kind of. It's like their internal wiring gets crossed. Instead of accurately transmitting messages about touch, temperature, pressure, they're sending out these faulty signals like a misfiring alarm system.
So it's not just that something hurts, it's that the message about the hurt is all messed up.
Exactly. And that can lead to some pretty strange and unpleasant sensations.
Strange and unpleasant how? Give me the details.
Well, people with neuropathic pain often describe it as burning, tingling, shooting, sometimes even like an electric shock.
Yikes, that sounds awful. And this kind of pain, it can happen with a lot of different conditions, right?
Unfortunately, yes. Diabetes is a big one, especially when it affects the nerves in the feet and legs, leading to diabetic neuropathy. And with multiple sclerosis, where the body's immune system attacks the protective covering of the nerves.
Right, like we talked about with the woman who had the foot pain.
Exactly. MS can cause all sorts of sensory issues, including neuropathic pain. And then there's things like shingles, the viral infection.
Yeah, I've heard of that.
Well, shingles can leave behind this lingering nerve pain called postherpetic neuralgia.
Oh, so even after the initial infection clears up, the pain can stick around. That's not fair.
It's definitely not. And those are just a few examples. We can't forget about trigeminal neuralgia, which affects the trigeminal nerve in the face.
Oh, I've heard that's one of the most painful conditions out there. Isn't it sometimes called the suicide disease?
It is, unfortunately. That nickname gives you an idea of how excruciating it can be. Imagine experiencing sudden, intense pain in your face, triggered by something as simple as brushing your teeth or a light breeze.
Oh man, that sounds unbearable. And these are the kinds of pain that traditional treatments, like pain meds, often struggle to address effectively.
Exactly. Traditional approaches often fall short. They might mask the pain temporarily, but they don't address the underlying issue, those faulty nerve signals.
So it's like trying to put out a fire with a water gun. It might help a little, but it's not getting to the source of the problem.
Exactly. And that's where cryoneurolysis offers a whole new approach. It's not about masking the pain, it's about going straight to those misfiring nerves and like hitting the reset button.
Okay, so it's like we're giving those nerves a chance to recalibrate, to start sending the right signals again.
That's a great way to put it. And because the effects can last for so long, it could mean people need fewer pain meds, maybe even none at all.
Wow. And that right there, that's a game changer. Especially when you think about the opioid crisis, the risks of addiction, the side effects. This could be a real lifeline for folks struggling with chronic pain.
It really could. And speaking of game changers, there's another potential application for cryoneurolysis that has researchers really excited.
Okay, lay it on me. What else can this cryotherapy wizardry do?
Well, what if I told you that cryoneurolysis could be used as a preemptive strike against pain, especially after surgery?
Wait a minute. Preemptive, as in stop the pain before it even starts.
You got it. Preemptive analgesia. They're looking at using it to make those first few days after surgery way less painful.
Okay, now you're speaking my language. Sign me up. But seriously, how does that even work?
So using ultrasound, they identify those nerves that carry pain signals from the area that's going to be operated on.
So they're like mapping out the pain pathways in advance.
Exactly. Then, before the surgery even starts, they apply cryoneurolysis to those nerves. And it's like, boom, instant numbness that lasts well beyond the surgery itself.
Okay, so you wake up from surgery, and the pain is, what, already gone?
Not necessarily gone entirely, but significantly reduced.
Still, that's huge. Less pain, fewer pain meds, faster recovery. It's like a win-win-win situation.
Exactly. It's a potential game changer, especially for people at higher risk for complications from opioids or anyone facing those tough surgeries with longer, more painful recoveries.
Okay, so we've covered a ton of ground here. We've talked about spasticity, chronic pain, even preemptive pain management. Cryoneurolysis really seems like a jack of all trades, but let's be real, it's not the only option out there, right? How does it stack up against the other treatments available?
You'd right. It's important to remember cryoneurolysis is one tool in a toolbox, and the base approach always depends on the individual and their specific situation. It's a conversation between the patient and their healthcare provider to figure out what makes the most sense.
Okay, so let's talk toolbox. For spasticity, we've got Botox, which we've mentioned. Then there's surgery, which is obviously a bigger deal. Where does cryoneurolysis fit into that spectrum?
It's kind of like the middle child. Less invasive than surgery, longer lasting than Botox. For a lot of people, it bridges that gap perfectly, provides significant and durable relief without the bigger risks or recovery time.
That makes a lot of sense. And for pain management.
Well, we've talked about how it compares to opioids, which is huge, but there's also nerve blocks, which are pretty common for pain management.
Right, nerve blocks. That's where they inject an anesthetic near the nerve to block those pain signals, right?
Exactly. And they can be very effective, especially for targeted pain relief.
But the effects are temporary, right?
Right.
You need to keep going back for more shots.
Unfortunately, yeah. And that's another area where cryoneurolysis really stands out. It can provide pain relief that lasts for months, sometimes even years from a single treatment.
Okay, I'm sensing a theme here. Fewer injections, fewer doctor's visits, fewer disruptions to your life. Sign me up.
It's definitely something to consider. And the most exciting part is we're still learning. New research on cryoneurolysis is coming out all the time. Who knows what other applications we'll discover in the future?
It's like a whole new world of possibilities. So as we wrap things up here, what's the one thing you want our listeners to take away from our deep dive into cryoneurolysis?
I think the biggest takeaway is simply this. Stay curious. If you're struggling with pain or spasticity, don't be afraid to ask your doctor about cryoneurolysis. It might not be the right fit for everyone, but for some people, it could be life-changing.
Knowledge is power. Right. The more you know about the options available, the better equipped you are to advocate for yourself and your health. So there you have it, cryoneurolysis. A deep dive into the fascinating world of freezing nerves to relieve pain and improve mobility. We've covered a lot of ground, but this is just the tip of the iceberg. As always, we encourage you to do your own research, talk to your healthcare providers, and stay informed. Thanks for joining us for another deep dive.